Good evening to all. I welcome all the participants for this session 2, that is machine learning application in biomedical signal and image processing. I would like to introduce today's resource person, Dr. Nishant Jain, completed his MTech in instrumentation and signal processing from IIT Roorkee in 2012. In 2017, he received PhD from IIT Roorkee in the area of medical image processing. Presently, he is working as assistant professor at JP University of Information Technology, Solan, Himachal Pradesh. His area of interest include image processing, machine learning, and IoT. He has various publications in SCI indexing journal and currently guided 3 research scholars whose working area of medical image processing. He, he has given many talks in various FDPs and workshops in his career. He is an active resource person on YouTube and uploaded more than 100 educational videos. He is a member of Center of Excellence in Healthcare Technology and Informatics, and also Incubation and Entrepreneurship Development Cell at his university. Thank you, sir. Thank you, sir.
Thank you, Dr. Grish, for the nice introduction. So shall I start?
Yes. Sir.
Okay. So good evening to all. So the topic that I am going to discuss in this particular session, it is the application of machine learning in biomedical signal and image processing. And because like the participant, they may have different backgrounds, so like I will start with the acquisition of biomedical signal and images, because the first, like before applying the machine learning, we should know how we are acquiring or how we are capturing the signal or the images, and how doctors, they are diagnosing the patient with the help of these signals or images. So we should know about this fundamental, so that then only we can apply some engineering tools. And the engineering tool that I am going to discuss in this particular session, it is related to machine learning. And in machine learning, like I am going to discuss two different categories, like computer aided diagnosis system and the convolutional neural network. So over here, I will just give you the basic concept about the machine learning, and I will not go into the detail or the methodology with of the neural network or SPM. Just I will give you the idea that how we are able to use the machine to take decision. And then at the end, I will then discuss about the applications, that after how we are replicating the radiologist or the doctor, the way they are diagnosing the patient using the signals and the images. Then we are going to discuss how we are doing it with the help of machine. So starting with the acquisition of biomedical signals, so like from our human body, we can capture the signal from brain, from heart, from muscles, from eyes, from ears. So different activity, electrical activity, can be captured with the help of the electrodes. So, and they are categorized into they are categorized according to the organ, or from where we are capturing the signal. So the first one is the electroencephalography, and it is the electrical activity that we EEG capture the electrical activity of the brain. So in the brain, we different ionic activity that occurs. So that ionic activity creates voltage fluctuations, and that voltage fluctuation is captured with the help of the electrodes that are placed on the brain, and the activity is then recorded in the form of a graph. So, and that graph is known as electroencephalograph. to capture the activity, we can place the electrodes. Either we can use 4 electrodes, 8 electrodes, 19 electrodes. It depends on the requirement. Like if we just this 4 electrode, they will just give you the basic idea about the brain. 8 electrode will give you little bit more detail, and 19 will give you more the detail for the severe abnormalities. So it depends on the requirement of the a diagnosis that for which we use 4, 8 or 19 electrodes. And the position are fixed. Fixed in the sense that these positions are fixed so that the proper activity can be recorded. If we are using a 16 channel, so from the 16 electrode, from this if we are getting this 16 channel EEG waveform, we are going to get waveform like this. And for a layman, like if we are going to see these signals, so it is quite difficult for us to get information from this signal and to diagnose the patient. But since doctor and the radiologist, they learn in their domain knowledge, they learn that how to analyze this signal. So they are able to read these signals, and looking at these signals, they are able to diagnose, and they are able to identify the type of the abnormality that is there in the patient. So for example, from this signal, in this signal, all the EEG signals, we have different rhythms known as delta, theta, alpha, and beta. And these rhythms can be classified with the help of the frequency and the amplitude. Frequency, like if you look at the frequency delta, frequency range of delta, it is ranges from 1 to 4 hertz. Theta, it is 4 to 7, alpha 8 to 12, beta, it is 13 to 30. And if you look at the amplitude, it is in microvolt. So, and the range is 20 to 200. For theta, it is 10. For alpha, it is 20 to 200. And for beta, it is 5 to 10. Now, what is the difference between these rhythms? This delta and theta, like in alpha, alpha is the activity. It occurs when the adult is awake but relaxed with eye closed. Means we are just about to, we have just planned to go to sleep. So in that case, we are just in a relaxing position. So at that particular time, our brain, the electrical activity that is there in our brain, it just generates alpha rhythm, having the frequency this. When we are like, as people move from lighter to a deeper stage of a sleep, the occurrence of alpha wave diminish, and it gradually replaced by the lower frequency theta and then delta. So as we are going into the deep sleep, so gradually alpha will change to theta and theta will change to delta. And if you look at the beta, so it occurs in an individual who are alert and attentive to external stimuli. So normally when we are like awake, so we used to generate beta, and the this frequency, it keeps on changing depending on the alertness or the external stimuli according to which our brain reacts. So what happened that with the help, because we know all this activity and we know the frequency range, we know the amplitude. So with the help of this, like if we capture this type of EEG, and from the EEG, if we try to get the frequency component using like Fourier spectrum or something like that. So if we try to get the frequency of these signals, so the range of the frequency, if it lie in this, we can come to the conclusion that the person is in deep sleep. If the frequency lie in this range, we can predict that the person is awake. The person is not yet asleep, but the person is relaxing. So according to the frequency range, we can get some idea. Apart from this, there are some other events or activities that we can note in the EEG signal. Like we have a K complex, and what is K complex? That it is associated with a sharp component and often followed by 14 hertz phase. Means first the wave of about 14 hertz will be there, followed by this sharp component, and it occurs spontaneously or in response to a sudden stimuli during sleep with an amplitude of about this. Means if the EEG that is recorded if in this recording, if we get a frequency range of 14 hertz, and just after that 14 hertz, if we get a sudden impulse, so we can come to the conclusion that the person was in sleep, and during the sleep there is some sudden stimulus. So it can be like in the dream the person has seen something, so that type of sudden stimulus can be there. And with the help of this amplitude also, we can determine whether there is a K complex activity in the EEG signal or not. And depending if it is K complex, we can predict something about the quality of the sleep. Similarly, another event, it is lambda wave, and it is related to the eye movement and are associated with visual exploration. Okay, and the amplitude, its amplitude is less than 50 millivolt with a duration of this. So if this type of wave is present in the EEG, then it simply means that there is some eye movement. Okay, so we just by looking at this, we just in the EEG signal, we just need to identify if lambda wave is present in this waves or not. If it is present, we can conclude that there is some eye movement. Another thing is like another event is vertex sharp transient or V wave, and it occurs spontaneously during sleep and in response to a sensory stimulus during sleep or wakefulness. We have mood rhythm. It is blocked or attenuated by contralateral movement, thought of movements, or readiness to move, or tactile stimulus. So overall, like these are the different activities or the events that may be present in this EEG. And when we need to diagnose the patient for different abnormality or for different activity, then we just need to identify whether these rhythms are present or not in the signal, or this type of events are present or not. And if it is present, we can conclude about the patient or about the mental condition of the person. Okay, apart after this, the different another activity that we can record is the ECG, electrocardiography, and it is the electrical activity that we captured from the surface, from the heart surface. Okay, like different contractile activity of the heart, it causes this generation of time variant voltages of different amplitude and duration. Like you can see, this is the heart pulse, and this is time scale, and the amplitude of this electrical voltage, it is changing with respect to time. Okay, and if we record it, then it gives us the ECG of a patient. Now in this ECG, we have different components. Like in one cycle, we have three waves. We have two intervals and three segments. The three waves are P wave, QRS, and T. You can look at this diagram over here. This is the P wave, this is QRS, and this is T. Two intervals that are there, it is PR interval and QT interval, means the time, the duration that we take, that the signal takes from P to R. So this duration is one interval, and the QT means from this to this T, it is the second duration. So, and apart from this interval, we have three segments: PR segment, ST segment, and TP. So with the help of like all these waves, intervals, and segments, they have a proper amplitude range, they have a interval range, and so with the help of this amplitude, frequency of this peak, and the duration between this PR interval and QT interval, it simply helps the doctor to diagnose the patient for the different abnormality that may be there. And the different abnormality that can be identified, it may be related to the myocardial infarction, coronary artery disease, multiple type of arrhythmia. It is this arrhythmia, it is the like heartbeats are not in a proper sequence, so it is the arrhythmia. Coronary artery disease, if there is some blockage in the artery, then it causes the this type of disease. And myocardial infarction, it is the abnormal flow of the blood. So if all these type of different activity like abnormal flow of the blood is there, or the artery is blocked, or the heartbeats are not proper, all this activity can be monitored by the doctor just by looking at this ECG waveform. And the way doctor used to identify it is just by noting this, by just calculating the amplitude and the frequency of this waves, intervals of these waves. And with the help of this, doctors are able to diagnose the patient. Next type of biomedical signals that we can capture, it is the electromyography, EMG. And EMG, it is the electrical current generated in a muscle during its contraction, and it simply provides the data about the neuromuscular activity or the muscular morphology. Like whenever we all the muscular activity and the activity of the neuron of our nervous system, that can be monitored with the help of this EMG, and it gives us a valuable tool to for an accurate diagnosis of neuromuscular disorder. Myopathy and neuropathy. Myopathy is it is related to this muscle tissue activities. Okay, and this neuropathy, it is a collection of disorder that occurs when nerves of a nervous system are damaged. So if there is any problem related to the nervous system, nerves of a nervous system, that can be identified with the help of EMG. And if there is any problem related to the muscle activity, then that can also be recorded or diagnosed with the help of electromyography. We can capture this EMG with the help of either using the surface electrode or the needle electrode or the wire electrode. And this EMG, when we are recording the EMG, like in a muscles, there are different motor units. So if we are capturing when we are if we are capturing the EMG of a single motor unit, it is simply a impulse fired at regular interval of time. Okay, if the EMG is captured just of a single unit. But if we are capturing the EMG, all the individual wave, they will get interfered with each other, and we will get a complex interference pattern. And with this, what we can conclude, that if only a single motor unit, if only one is active, we will simply get a waveform like this. But if multiple number of motor units, they got active, then we are going to get a signal somewhat like this. Signal will get interference with each other. So if we simply put this data in on a speaker, so this when we fed this signal to the speaker, discrete firing sound is produced. But if we increase the level of activity of a muscle, if we just contract the muscle, then more motor units will get recruited, means more motor unit will get activated, and this will produce this type of a signal. And when this type of signal is fed to the speaker, we will get a chatter sound. Okay, so just by whatever EMG that we are able to capture, if we just put it onto the speaker, the type of a sound that we are going to get, with the help of that sound, we can diagnose that what type of activity is there in a muscles. So like in EMG, if EMG shows an electrical activity in a resting muscles, then it indicates a muscle disorder. Means like our muscle is in a resting position, we are not doing anything, but still if there is some electrical activity, means still if we are able to capture some EMG when muscle is not active, then it simply indicates that there is some muscle disorder, or a disorder affecting the nervous or a disorder affecting the nerves that connecting to the muscles. Okay, nerves, it is related to like brain. So since brain is controlling all the muscles, so it may be the disorder in the muscle, or it may be the disorder in the nerves that connects to the muscles, or there may be some inflammation caused by an injury. So if the muscle is in a resting position, we are not doing anything, we are not activating the muscle, but still there is some electrical activity, then it simply means that there is some problem. If EMG show abnormal electrical activity when a muscle contract, then it indicates nerve disorder. It means that if we contract our muscle, the EMG that we are recording, if the EMG is not proper, if it is giving a abnormal wave, then it simply indicates that there is some problem related to the nervous system. So in this way, we can identify from the EMG that if there is some problem related to the muscles or there is some problem related to the nerves present in the nervous system. Like in one of the research paper by Sangeeta and others, like they presented this table. And in this table, they simply classify whether the activity is normal or the patient have myopathy or neuropathy. Okay, myopathy means the problem related to the muscle, neuropathy, the problem related to the nervous system. And they just calculate this parameter, these three parameters: maximum power, frequency at the maximum power, and the total power. And they conclude that if the maximum power is lie in this range, is this, and the frequency is this, and total power is this, then the patient has normal, like there is no problem with the muscles or the nerve system. Everything is okay. But if the maximum power is this, frequency is this, and the total power is this, then the person is suffering from myopathy, means there is some problem related to the muscles. And if the maximum power is this, frequency is this, and total power that is coming out is this, then the problem is related to the nervous system. So in this way, using some engineering parameters, we can try to get some engineering parameter that we can calculate, and according to the value of that parameter, we can classify whether the EMG belongs to the normal or EMG has some myopathy or neuropathy. And the next biomedical signal that I am going to discuss, it is electroocculography, EOG, and it is the signal that we capture from the eye movement. So we just place electrodes at this three position, and by placing the electrode at this three position, we are able to up to now, I have discussed about the different biomedical signals that we can capture. And apart from capturing, how doctors used to diagnose the patient with the help of this signal, that simply we need to look some of the parameters associated with the abnormality in these signals. And if these parameters are present, then accordingly, doctors predict the abnormality. And in the same way, if we try to develop some machine learning, if we try to develop some system or machine learning technique, then we can quantify all these parameters and can try to give this parameter to the machine to train the machine. Participants, if you have anything to ask, you can put it in a chat box. Okay. So after this, the next is that how we can acquire the medical images. So when we talk about the medical images, so the concept of acquiring the images, like if we if we just consider this particular block diagram, in this block diagram, if this is a sensor that is sensitive to the input energy, this sensor simply convert this input energy into the analog voltage signal, and then this analog voltage signal is converted into the digital value with the help of ADC, analog to digital converter. Now suppose if this input energy, if the sensor is sensitive to say light, then this sensor, like if light falls on the sensor, then that light intensity will be converted into the analog voltage signal and then to the digital value. If this input energy, if it is the X-ray, means if the sensor is capable to sense the X-ray, then this sensor will convert the input X-ray into the analog voltage signal, and then the analog voltage signal will be converted into the digital value. So it means that just depending on the type of the sensor, means the sensitivity of the sensor, whether the sensor is capable to sense the light or X-ray or MRI or ultrasound. So depending on the capability of the sensor, this we can simply convert the input energy or the input energy into the digital value. And why digital value is required? Because we are using the digital system. So at the end, we should need the digital value. Now, if we arrange this assembly in grid form, something like this, then we will be able to form an image. Means like this is one unit, this is another unit, this is third unit, and so on. So this unit will sense this signal that falls in this area. This will sense the signal that fall in this area, and so on. So all the unit will work independently, but overall we will get an image. So same concept, using the same concept, we can form the natural image that we capture from our mobile phone. We can scan the X-ray, we can X-ray the MRI, we can use the ultrasound energy, we can form any image just by using this principle. Only thing is that our sensors should be sensitive or should be capable to sense this particular input energy. So we can form different type of images. And when we talk about the images, so images, they are just a matrix, because like this image, it looks like this, it looks like a circle to me. Okay, it looks like color to me, but for a computer it is just a number. Okay, so when we store our images onto the system, it is simply a number. And when we say the image processing, so it simply means that we are doing some manipulation. We are just manipulating the matrix associated with that image. So if I simply consider this particular image, this is a grayscale image. So it is simply a two-dimensional matrix. If I look at the color image, we know that any color can be formed by just mixing three colors, red, green, and blue, in different components. So it means that color image, it is a three-dimensional image. Okay, so but again, it means it is a three-dimensional matrix. So when we need to process the image, we need to form the relation. Like if we for this particular boundary, it must be all the matrix value or element of the matrix corresponding to this location, it must be same. So we can extract the pattern and then we analyze. When doctor used to see these images, like doctor from their domain knowledge, because they learn all these things in their studies. So like for us, if you look at this particular image, this is a CT image, this is the MRI image, and this image is captured from the patient, same patient and same area. Means these two are the brain of the same patient, but still you can see that CT is giving different information and MRI is giving different information. If we look at the ultrasound image, so ultrasound, it is not the ultrasound of the brain, but ultrasound gives totally different type of information. And like the person who is expert to in MRI image, that may not be able to or that doctor may not be an expert in seeing the ultrasound images, because if the doctor is looking at the ultrasound image, then the object looks different in ultrasound image, the organ look different in MRI image, it looks different in CT image. So means different information we can get using the different medical imaging modality. Okay, like over here, if you look, compare these two. So using the CT, we are able to capture the bone structure of the CT of the brain. Whereas using the MRI, we are able to capture this information about the soft tissue or inside the brain. So if the doctor want to look at the brain tissues, then it is recommended to take the MRI, but if bone structure is required, then CT is prescribed. So depending on the abnormality that doctor feels the patient may have, doctor suggest the scanning accordingly. If there is any fracture in the bone, then X-ray is suggested. So, but the processing part, when we come to the processing part, because doctor like information that are present in CT, in MRI, in ultrasound, in thermal, they look different. Same information, same brain, but different information. So we need to apply different for processing methods to analyze these images. So this like X-ray, it is used to get the structure of the human body. CT, it is used to create the cross-section image of a body organ. MRI, it is used to get the information of the soft tissue. Ultrasound, it uses the high frequency sound waves to image body organs. And this positron emission tomography, it uses the radioactive drug to scan the function of tissue and organs. So overall, we simply try to extract different property or characteristic of the body organ so that the diagnosis can become easy. And the challenge for the medical practitioner, radiologist, or the doctor, it is that same body organ that look different when diagnosed with different imaging modality. And interpretation, like for the ultrasound images or for this also, like sometimes interpretation, it really requires a expert opinion. Experience of the radiologist is also is also impactful. Like if the radiologist is experienced, then complex images can be diagnosed more properly. So the area, like the requirement of the machine learning or the engineering in this domain, is that we should provide doctor some tools, engineering tools, that may help them in diagnosing the medical images and the biomedical signals. So now how we can provide the tools? One of the tool is with respect to the machine learning. So in machine learning, basically, like there are two different type of approaches. One is computer-aided diagnosis system, another is convolutional neural network model. So I will start first with the CAD system, computer-aided diagnosis system. So the steps that we need to follow for in this system, it is like first is the input. It may be the signal, it may be the images. From that signal or images, we try to extract some features. That features, it can be like, if it is a signal, we can try to capture the range of the frequency, we can try to capture the amplitude or some gradient deviation or some any features. From the images, similarly, we have different type of features that we may extract. We are going to discuss in the coming slides. Then out of that feature, whatever features that we extract, out of that feature, what are the relevant features that we should keep, and some feature we may discard. So how we can select the best features? So that is done in this particular step, feature selection. Once we selected the best features, then that features are given as an input to the classifier, or to do the classification, or to do the clustering. So, and then finally we are able to label means that we are able to predict whether the image have some abnormality or not. If it has abnormality, then what type of abnormality is this? So that type of prediction can be done. So starting with the feature extraction. So as I told you in the starting itself, that over here I am not going into the mathematical side. So I will just give you the idea. I will just give you the idea that what we mean by feature extraction and how extracting the feature really helps in making our machine in making machine learn properly. So the first, if you look at this particular waveform, so could you find the difference between these two waveform? You can type the answer. And one thing, like if you look at the shape, it is exactly same. So what may be the difference in these two waveform that you can see? You can type in a chat box, or you can unmute yourself and you can answer. Like I am in this particular question only, that over here I am just going to tell you how we can extract the feature and what is the relevance of the feature, extracting the feature. So we are on that particular question only.
Are you going to explain how you are going to do feature extraction in MRI images?
Yeah, I will explain. Means I have put the slides, so I will explain it.
Thank you, sir. Thank you.
So over here, if you look at these two waves, the shape is exactly same. Okay, but if we look at the range, like in this particular wave, it ranges from -10 to 10, whereas this particular it ranges from 10 to 20. So with the help of this range can be the parameter that differentiate between these two waveforms. Waveforms are shape is same, but amplitude range is different. So depending on the range, we can classify these two waveforms that looks exactly same. So that this range can be one of the parameter with the help of which we can classify whether the waveform belongs to class A or class B. If you look at this waveform, it is simply the sine wave. But could you identify or could you name what type of a waveform it is? You can put the answer in a chat box or you can unmute yourself if you want to answer. If to analyze this signal, if we simply do a Fourier transform, if I simply represent it like it is in time domain, varies with respect to time. If I simply take the spectrum, means I just represent represent this waveform in frequency domain, then I will just get a single impulse at a particular frequency, because this is sine wave contains only once a frequency. Now, similarly, if I simply do a Fourier transform of this particular signal, then the Fourier spectrum will give me this frequency spectrum, means only two impulse, one at this frequency, another is this. And just by looking at the spectrum, I may conclude that this particular waveform, it consists of two sine waves of different frequencies. Means it is over here, it is simply the sine waves. And I simply, like in a MATLAB, I simply add two sine waves of different frequencies. So if we look at the raw data in the time domain, it is simple to identify that it is a sine wave. But when I simply add two sine waves, it is quite difficult to identify for a human being. For us also, the people who know signal processing. But if I simply take the Fourier spectrum, now looking at the Fourier spectrum of this and this, it is quite easy for us to identify that this waveform, it simply consists of two sine waves of different frequency. So it means that if I want to classify or if I want to identify the signal, I can transform the signal from time domain into the frequency domain, and depending on the number of amplitudes that I get at different frequency, I can do some comparison between the two signals. So that is the beauty of the signal processing, that simply like the information that I am not able to see in this time domain signal, but for this time domain signal, I am able to get information in the frequency spectrum. And for a computer, because our computer is a digital device, we are able to see the things, but for a computer, everything is just a number. So with feature extraction, we are just trying to quantify, we are just trying to convert the information into some numbers so that computer can then process that number to do the classification of the clustering. If I look at these images, this is one image, this is second image, third, fourth, and so on. Now, is it like from the look, you can see that it is the variation in the pixel intensity, it is very less, it is smooth. there is some roughness in this particular image. Roughness got increased in this. It is again, roughness is more, means roughness, if I look at the roughness of the surface, it is increasing from left to right. And then after this, yeah, over here roughness has increased more. So roughness is increasing from left to right. Right now, how it is, I am able to see this, that roughness has increased. But is there any parameter, any mathematical parameter or statistical parameter with the help of which we can determine about the roughness just without looking at the image? Is there any way? Now simply, if I calculate this standard deviation, means like as I told you that for image simply means a matrix, and matrix has the values. Each and every element of a matrix will have some numerical value. So if I calculate the standard deviation of all the values, so I get standard deviation for this image as 5.88, standard deviation for this as 9.74, for this it is 12.79, 20, and so on. So you can see, as the roughness has increased, the value of standard deviation is also increasing. And now from this I get a correlation. Means now after this, I do not even need to see the image. If someone is asking me to compare to like if some person bring two surface and ask me, tell me which surface is smooth and which is rough, so I can ask that person to simply calculate the standard deviation and tell me the value of the standard deviation. So if the person say that for the surface 1 the standard deviation is 3, for surface 2 it is 5, so simply by comparing the value, that 3 is less than 5, so the since 3 is less than 5, so it means the surface for which standard deviation is 3, it is more smoother in comparison to the second one which has a standard deviation 5. So I do not need to look for this complete image. A single value will serve the purpose. If I just need to make a decision which surface is smoother, I just single number can serve the purpose. And if I go for a machine learning or artificial intelligence, so when extracting the feature simply means that instead of providing the complete image and loading the machine, we are going to select some feature, we are going to calculate some feature from the image or the signals, and then we are going to provide that value to the machine so that machine can simply make a prediction. Like once I calculate the once I know that standard deviation is a good parameter to identify the roughness, now simply if else, using the if else condition, I can simply put if standard deviation of surface 1 is less than surface 2, then print that surface 1 is smoother, otherwise print surface 2 is smoother. So in this way, simply the if else will be able to predict. Now we have like different statistical parameters that we can calculate from the signals from the images. Like we can have mean, median, standard deviation, skewness, curtices. We can calculate the minimum value, maximum value, range, entropy, energy present in the signal, power, root mean square, percentile, difference between the two percentile, and many other. Over here, let me discuss this GLCM, which is with respect to the images. So GLCM, like again, the purpose of feature extraction is just to quantify the parameters, means what features, what characteristic that is present in the image, we are just trying to capture or quantify that particular characteristic. Like suppose if in an image, if we have some vertical lines, if one image has some vertical lines, another image has some horizontal lines. So and if the question is that we need to identify whether the image has horizontal line or vertical line. So without looking at the image, because the machine learning, our machine learning technique that we are going to use, that machine learning is not going to see the complete image. We need to provide the quantified value, the features we need to provide. That, and with the help of that feature, machine should be able to predict what type of characteristic is there in the image. So over here, if you look at this GLCM, so it is a second order texture measure based pixel pair relationship, and GLCM stands for gray level co-occurrence matrix. If I want to calculate the GLCM, then first of all I need to decide like what is the D, means the distance between the two pixels, and I also need to determine the angle theta. So suppose if I decided that I will just consider D as 1 and theta is 45, means all this pair of pixels, means if one pixel is there and another pixel is located in this direction, then I will form a pair of these two pixels. For example, suppose if we have this image, okay, I simply, like if I have this image, I simply take the consider it as a matrix, and if this matrix has this value 0, 1, 2, 3 and so on. So first of all, I need to determine the GLCM matrix, gray level co-occurrence matrix. It is the gray level co-occurrence matrix calculated for D equals to 1 and angle is 45 degree. So in this image, I just need to determine all number of pairs between having value 0, 0, number of pairs having value 0, 1, number of pairs having value 0, 2 and so on. So if I try to look at the number of pairs having value 0, 0, so if I start from this pixel value, this one, so corresponding to this, there is no pixel over here, so I have to skip this complete row because all these values does not have anything to form a pair over there. So I will go to the next line. In the next row, if I consider this 0, 2, 0, so at angle 45 and distance 1, we have 2. So it can be a 0, 2 pair. Okay, but it is not a 0, 0. First of all, I need to calculate the number of pairs having value 0, 0. So I will move to the next, and over here I found this is 0, and at angle 45, I again get a 0 pair. So it is 1, 0, 0 pair oriented at angle 45 degree, and the distance is just 1. Now after this, I will go to the next row. This is 0. Again, it is forming a 0, 2 pair. I move forward. It is forming a 0, 1 pair. I move forward. It is another 0, 0 pair. So moving in this way, I can see that all this red ellipse. So in total, I have 6 pairs of 0, 0 oriented at angle 45 degree. Will check the number of pairs between 0 and 1. So again, I marked it with red, with green. So in total, we have 1, 2, 3, 4, 5, and 6. So 6 number of 0, 1 pairs. Similarly, 0, there is no 0, 3 pair. And then 1, 0, 1, 0, this 1, 0 and this 0, 1, it is different. 0, 1 means that the pixel that I am considered at angle 45 degree, the value is 1. Like if I consider this, it is 0, at 45 degree, it is 1. If I look for 1, 0, it means, this one, this is 1. So at angle 45 degree, we have 0 over here. Okay, so it is 1, 0 pair. It is not a 0, 1 pair because we are considering this particular pixel, and with respect to this pixel at an angle 45 degree, we are just checking what is the value of the pixel. So 1, 0 and 0, 1, they are different. So considering all the 1, 0 pair, we have total 7 1, 0 pair, 5 1, 1 pair, 4 1, 2 pair, and so on. So in this way, we can form a GLCM matrix, gray level co-occurrence matrix. Once we form the gray level co-occurrence matrix, then we will determine the probability. For determining the probability, this is the GLCM matrix that I obtained. So I will just add all these numbers Adding all this number, it will give me 49. So I divide all this number by 49. 6 by 49, 6 by 49, 2 by 49, 0 by 49, and so on. So this gives me the probability. And once I get the probability, now from this matrix, I can determine this different texture parameters that are defined by the Harelick. Harelick is a scientist who has discovered this GLCM matrix, who has given this theory. So after the determination of this GLCM, I can then determine all these features. Over here, just for the explanation that what is the relevance and what type of feature GLCM can calculate, I am just going to consider the first two parameters, the angular second moment and the contrast. The formula to calculate the angular second moment, it is simply the summation of all the probability that we obtain. Means we obtain this matrix. If we simply take the square of all these values, and if I then add it, I will get the angular second moment. To get the contrast, the formula is this. And this formula can be represented with matrix also. Over here, this n square, it is this, like n square, the value will be 0, 1, 4, 9, and so on. And if I multiply this value with the probability matrix, this matrix, then after multiplying this with the probability matrix and adding all the values, I will get the contrast. For example, if I consider this particular image, this is in this image we have the horizontal rows. You can see this is one strip of this brown shade, this is white shade, this is brown. So, and over here I just consider for the explanation purpose, I just consider value 1 and 0. So if I now try to calculate the GLCM matrix for this image at angle 0 degree, 45 degree, and 90 degree at a distance of 1. So if I try to calculate the GLCM matrix, then I need to form a pair of 0, 0, 0, 1, 1, 0, and 1, 1. And from this, I will get this matrix at 0 degree. You can see at 0 degree, it means I will form a pair. Like if I consider this one will form a pair with this. So it is 1, 1, 1 pair. This one is the second 1, 1 pair. This is the third 1, 1 pair. And this is the 4, 1, 1 pair. So in one row, I have 4, 1, 1 pair. In this row, again, I have another 4 pairs of 1, 1. And over here, again, another set of 4, 1, 1 pair. So 4, 4, and 4, total 12 1, 1 pairs are there. So this is 12 over here. Similarly, we have 4 pair of 0, 0 over here, 4 over here. So total 8 pairs. So I put 8 over here. There is no pair of 0, 1 at angle 0 degree. So it is 0. There is no pair of 1, 0. So it is 0. So I calculate the GLCM at angle 0 degree. Similarly, I calculate the GLCM at angle 45 degree and I get this value. And I calculate GLCM at 90 degree, I get this value. And then I calculate the probability of the matrix, I get this. Now from this matrix, I calculate the contrast and the ASM. ASM, I told you, they simply we will take the square of all this value and we will take the sum of the square of the values. So taking the sum of the squares of this value, I get 0.52. Taking the sum of the square of this value, I get 0.25. And taking the sum of the square of this value, I get 0.25. And about the contrast, to calculate the contrast, simply I need to multiply this value with this, means 0.4 into 0 plus 0 into this one plus 0 into this one and 0.6 into this. Means I multiply element by element, and after multiply I will take the sum. So it means that if we are going to get all zeros, because 0.4 into 0 I get 0, 0 into 1 I get 0, this 0 into this one I get 0, 0.6 into 0 I get 0. So overall the contrast at angle 0 degree, it is 0. At angle 45, calculating in the same way, at angle 45, I get contrast as 0.5. And at angle 90 degree, I get a contrast as again 45. I get a contrast as 0.5. Now, if I change the image, and previously we have horizontal lines, now we have a vertical lines. And again, if I calculate the GLCM at different angles, 0 degree, 45 and 90 degree, and then I get the probability matrix. And after getting the probability matrix, if I again calculate the contrast and the ASM. So now in this particular case, you can see that the contrast, I am getting the contrast 0 for angle 90 degree. And maximum ASM I am getting for 90 degree. In the previous case, I am getting contrast 0 for 0 degree and maximum ASM at 0 degree. So from this, we can conclude that if in an image, if I calculate the GLCM probability matrix, means this matrix, and from this GLCM matrix, if I calculate the contrast and ASM, then if contrast is coming out to be 0 and ASM is the highest among all this 0 degree, 45, 90. So if contrast is 0 and ASM is 0.52, then it means that my image consists of the horizontal lines. Again, I do not need to see the image. Simply, without looking at the image, I will just ask the person to calculate the person, means I will ask the computer to calculate the GLCM, and from the GLCM determine the contrast and the ASM. And if the contrast is coming out to be very low and ASM is high in comparison to the other angles, then simply I can conclude that my image consists of horizontal lines. Whereas if the contrast is coming out to be 0 for 90 degree and ASM is the highest for 90 degree, then I will conclude that my image consists of vertical lines. So I do not need to look at the image. I means my computer do not have to look at the image. Just by analyzing these numbers, means that by just forming the GLCM matrix and calculating the contrast in the ASM, and then on the basis of this value, my computer can determine what is the orientation of the lines, if it is horizontal or vertical. Now if I take another image, and this time, and again I take the probability. After taking the probability, I calculated the contrast and the ASM. Now in this case, again you can see contrast is coming out to be 0 at angle 45 degree, and ASM, it is the highest in case of angle 45 degree in comparison to 0 degree and 90 degree. So again, just by calculating the contrast and ASM, I can predict, means my computer can predict what is the orientation of the lines in the image. If it is horizontally aligned, or it is vertical aligned, or it is oriented at 45 degree. So in this way, apart from contrast and ASM, we have other parameters also in this Hartley that gives different type of information about the image. And when I say different type of information about the image, the purpose is that we need to quantify the features that are present in the image, so that that numeric value can be provided to the machine, and thereafter machine can train itself, and then we can do the prediction from the trained machine. Another, when we are doing a feature extraction, because like selecting, like as I told you that there are different feature extraction techniques that are available. So to determine which feature extraction technique I should use, to come to that conclusion, I should know the relevance of the values. Means like contrast, if we are talking about the contrast, so the contrast in an image, it simply means how easily we are able to classify between the two colors. how easily we are able to classify between the two colors. So over here, if I am calculating, like over here, if I am calculating the contrast at 0 degree, in this case, I am trying to calculate the contrast at oriented at angle 45 degree. Means what is the contrast if I move at angle 45 degree in this direction? When I am calculated at 90 degree, I am just trying to calculate the contrast. What is the difference? What is the contrast if I move from top to bottom or bottom to top? So what is the contrast is in this angle? So as you can see, if I move from left to right, the value is not changing. The value is not changing. So it means the contrast is 0. But if I move from top to bottom or bottom to top, then the contrast like 1 to 0 is there, transition is there. 0 to 1, again the value has changed. So there is some changes. So when there is some change, then it means that our contrast, it has some contrast, image has some contrast. Okay, if I am moving from at angle 45 degree, change is 1 to 0, so it is a change. 0 to 0, it is not a change. 0 to 1, again the value has changed. So moving at angle 45 degree, there is some change in the pixel value. So it simply means there is some contrast in the image. So, and accordingly, we are getting some value for angle 45 degree and 90 degree, but 0 for this 0 degree. So we should know the relevance, that why we are calculating the contrast, what is the significance of calculating the contrast and the ASM, and then only we can know, like when we are calculating the GLSM, we should know that this type of feature, whether the lines are oriented at horizontal, vertical, or 45, or even if like suppose in case if the line is oriented at angle 20 degree, if the line in an image is oriented at angle 20 degree, and if I calculated the GLCM at angle 0 degree, 45 degree, and 90 degree, in that case, our contrast will be, we will have some contrast for angle 0 degree and 45 degree. We will have highest contrast if we move at angle 90 degree. Okay, because 20 degree lie in between this range. So this 0 will increase little bit, this 0.5 will decrease little bit for 20 degree. For ASM, it will little bit decrease, it will little bit increase, and this will remain small. So it means that if we are not getting a 0 value, but we are getting some value like 0.1, 0.2, accordingly we can check, we can conclude that lines are not at 0 degree, but they are not 45 degree also. So it lie between 0 and 45 degree. So accordingly we can get the orientation of the line. And the overall purpose, that I do not want to see the image, I just want to quantify the features that are present in an image. Another type of a parameter that we may obtain, it is the local binary pattern. If anyone have any doubt with respect to the GLSM, you can type it or you can ask. Okay, so the next type of feature that we can extract, it is the local binary pattern. Now, local binary pattern, to calculate the local binary pattern, again the purpose is just to quantify the features. So when we are doing the when we are calculating the local binary pattern for an image, so suppose if this is an image, and if from at this particular pixel, if I just get the values of the matrix 3 by 3 matrix, okay, means this is the center pixel 8, and this 11, 13, 10, 20, 17, 11, 8, 7, they are the neighboring pixels. So for this, I am going to calculate the local binary pattern. So to calculate the local binary pattern, the formula is this, that we will simply set the value as 1 or 0 if the center pixel, like if this pixel, if the neighboring pixel, If it is greater than the center pixel, we will make the value S1. If the neighboring value is less than the center pixel, then we will make the value 0. So like we start from this 11. So since 11 is greater than 8, so we make the value as 1. This 13 is also greater than 8, so it is 1. 10, 20, 17, 11, 8. All are greater or equal to the center pixel. So all the values are 1. The last one, it is 7. It is 7. So since it is less, so it is 0. So once we get this binary pattern, then we convert it into the decimal equivalent number. So the decimal equivalent number for this, it is 254. So 254 is the local binary pattern for this pixel located over here. Now suppose the problem with the local binary pattern is that due to some reason. So if it got rotated, the orientation or the position of the neighboring pixels, they will over here. But due to the rotation, all these values also get rotated in such a way that 7 comes over here and 11 shifted towards right, 13 towards right, 10 shifted towards left, towards bottom. So all this shifted by one position in clockwise direction. 7 comes over here. 7, 11, 13, 10. Now, if I again use this formula to calculate the local binary pattern, now the 0 comes over here. Okay, previously 0 was over here, but now 0 comes over here, and the decimal equivalent for this particular binary pattern, I get the value 127. Means my image is same. It is only slightly rotated version of the previous one, this one. But a slight rotation simply changed the local binary pattern. Previously it was 254. Now after rotation it is 127. So now it means it is not a fruitful parameter because it got changed with the rotation. So to make it rotation invariant means that even if the image got rotated, the value should not change. So to make it rotation invariant, some researchers, they proposed this thing, that they simply proposed that whatever is the image, we will calculate it the local binary pattern. After calculating the local binary pattern, we will make all the shifting, binary shifting. Like for 254, for this image, we get this pattern, right? So we will do the shifting. We will shift this complete pattern by one position towards right. Okay, towards right. And this element, this value will be shifted over here. Okay, so you can see all this 7 elements, they are shifted by one position towards right, and this one, it is we put this at the over here. And now if I calculated the decimal equivalent number for this, I get 253. After this, I again make a shift by one position towards right, and then I calculated the decimal equivalent number. I get 251, then 247, 239, 223, 191. So you can see I have done all the shifting. And after doing all the shifting and after getting all this decimal equivalent number, the minimum decimal value that I obtained, that will be selected. So so we are not going to select this 254. Our local binary pattern for this image is for this image, first image, it will be 127. Now, if I again do the same thing for this one, for 127, we get pattern like this. Again, if I do a rotation, so I get all these possible 8 combinations. For these 8 possible combinations, we will have these 8 decimal values. And out of these 8 decimal values, minimum is this. Right? So again, you can see now that I get the value 127. So for this image and for this rotated version of the image, I get the same local binary pattern of 127. So just a small input, just make my local binary pattern and rotational invariant parameter. Now, even if the image got rotated little bit, the parameter will remain same. So these are some of the way that we can extract the parameters, and on the basis of the parameter we can then do the classification. Now coming back to this, once we extract different type of features, like there are there are a large number of statistical features and other parameters that we can extract from the image or from the signals. Now which one we should use? So that depends on the domain expertise. Means we can ask the domain expert like radiologist and the doctors, and we can try to get idea from them. Like as I told you that in the EEG signal we have alpha, beta, delta, theta rhythms. So, and all difference between the rhythms, main difference is the frequency range. So from the domain expert, I can get that information. In the EEG, the time interval between the two peaks, the amplitude of the peaks, the distance between the two ECG waveform, that difference, they gives the abnormality, they gives doctor an idea. So I will ask the doctor that what are the parameters that they look in the images or medical images or the biomedical signals, and according to that then I will try to quantify that parameter. So if doctor say that amplitude of the signal it's give relevant information, so I will try to get the amplitude of the signal mathematically, and then I will give that information to my machine learning. If the doctor say that frequency that are present in the signal, that gives important features, and that helps the doctor to predict the abnormality, then I can try to calculate the frequency and the corresponding amplitude at a particular frequency, and that information I can try to give to my machine, and so on. So according to the domain expert, because it is not possible, means it is possible, because we can write a program for all these parameters, but it is the best way to select the parameter is that we should ask the doctor or the expert in the area about how they used to predict, and accordingly we can try to select the features. Once we extract the feature, sometimes it is also required to do the standardization of the data, because there may be a chance that for some particular value the range lies from 0 to 10, for some other feature the range lies from 0 to 1, for some third feature range lies from 0 to 100. So the difference in the range or difference in the range values, it may do the biasing to for some particular feature in comparison to the other. So it is always better to do the normalization so that the range of all the features, they come in the same range. So for that, like we can use min max range, that whatever, if the range of one feature lies from 0 to 10, we will compress it to make it within 0 1. If some signal have range between 0 and 0.5, we will expand it, and we will again make the standardization that the final range will remain within 0 and 1. Or we can have a Z-score normalization, and with this normalization we just our data, after this normalization our data will have 0 mean and unit standard deviation. Means if I try to calculate after this Z-score normalization, if I try to calculate the mean of my data, then the mean value will be 0, and if I try to calculate the standard deviation, then it will come out to be 1. So if for all the data that are there, if I just make the mean 0 and standard deviation 1 using this, and in this way I just bring all the different features into the same standard form, and it helps us to reduce the noise, sparsity, and the irregularity of the clinical data, as well as align the scales of the various predictor variables. Also, sometimes like there may be a chance that we predict different features, and if we plot like it may be a requirement that it is always better to give low dimensional data to a machine instead of giving high dimensional input. Means if suppose if if I am able to do some transformation in such a way that after transformation I can select the best two features, and that two features are then given are then provided to the machine for a machine learning. So if instead of 10 features, if I am giving only 2 features, then that will be best for the machine, and machine will be able to learn the things more easily. So learning a suitable lower dimensional representation of a higher dimensional input space is a fundamental component of machine learning research. For example, if we look at the PCA, this is my original data. If we plot this data in a 3-dimensional X, Y, and X, Y, and Z. So if you plot the data in a 3-dimensional, so you looking at this data, you can see that all the data, it is oriented in this particular angle, right? And all the data are oriented in this particular angle. And if we look at the width, okay, second difference, 7 variation, it can be in this particular angle. So our data, which is in 3-dimension, it can be represented if we do a transformation like this. So same data can be represented in a 2-dimensional space instead of 3-dimension. And that in 2-dimension also we are exactly getting the same information. The variation is in this angle and this angle. So this help us to reduce the dimensionality, means less number of features are obtained, and that may be provided to the machine to train the machine. So that is the work with the help of this type of a techniques, PCA, we are just trying to reduce the dimensionality of our features. We are just trying to reduce the number of features. After this, feature extraction. So in this feature extraction, our purpose of feature extraction is to quantify the characteristic in the signal or the images. And once we extract the feature, we also need to standardize the data. We also have to try if we can reduce the dimensionality of our data, means our features, extracted features. After doing this, we also have to do the feature selection. What feature selection is? That suppose if we have this type of like we have some set of chair and we have some set of tables. And suppose if the question is that I need to or if I want to train a small kid, okay, and I want to train a small kid about the chair and a table, so that the kid will be able to classify that which one is chair and which one is table, means on which kid can sit and on which kid should not sit. So now if I suppose if I show all these images to a kid that this is a chair with backrest, armrest, and this flat area over here, backrest, armrest, flat area, and these are the table with a flat but no backrest, no armrest. So if I show these images to the kid, so one feature that I forgot to, or that I have not tell to the kid, it is the color. You can see that coincidentally, I select all the chair as black, all the table of brown shades. Now, kids, because it is a human tendency that we always try to take the easiest thing. So the kid may have the impression, may get an impression looking at these images that if the object is of black color, then it is chair. And if the object is of brown shade, then it is table. So it means the color, which is not the relevant information, but a kid may take that information because the images that I am showing or the objects that I am showing to the kid, they are coincidentally all black and all brown shades. So either I should tell that particular kid that this color information is not relevant. Do not look for the color. Okay, either I should tell the kid about that, or I should include chairs of different color also, or and table of different color. So either I should include all different type of colors for the chair and a table, or I should at least inform the kid, do not go with the color, and color is not the relevant information. So if I inform the kid, then kid will not take this as a feature, and there will not be any wrong training to the kid. So in the same way, if I am giving any feature to the machine which is not relevant, which is irrelevant, that feature may misguide the machine, and machine may train in a wrong direction. So I should remove all that irrelevant features. Now over here, again, this over here, if we look at this images, and our purpose is that we need to determine which is the best feature that can determine if the object is triangle or not. So could you identify which may be the best feature to identify if the object is triangle or not? Now over here, the feature, again, it should not be the color. The feature, the relevant feature is that triangle has 3 lines, and the angle between the 2 pair of lines, the sum of the angles between the 2 pair of lines, it should be 180 degree. So we should first get the information whether there is some straight lines or not, and if there is a straight line, then what is the angle between the 2 pair of lines, and that will give me the better picture, or that information, the straight line and the sum of the angle between the possible pair of lines, if it is 180, then I can conclude that it is a triangle. But selecting color as a feature is irrelevant, and that may misguide my machine. Another thing that we need to see in feature selection is about the redundant feature. Now, if you look at this particular graph, like with respect to the time, this is feature 1 and this is feature 2. Now, both this feature, they are varying in the same way. Like if it is going in this, if the curve is like this in feature 2, in feature 1 also curve is like this. So exactly the same variation is there in feature 1 and feature 2 with respect to the time. So since variation is same, so it's better to discard one feature, because both are giving the same information, exactly same information. So it is always better to take only one source of information. If the source of information, the 2 sources of information are providing the same information, then it's better to take only one source, one feature. So in this, we can select either this feature, feature 1 or feature 2, but only one should be selected. So this will avoid giving redundant information to the machine. So this is about feature selection. And once we selected the relevant features, then we come to this classification task. For the classification, especially when we are going for a neural network. So neural network, the perceptron, single neuron, it is a single neuron. So single neuron can classify the data by just forming a straight line. Like in our school days, we know that if in a graph, if it is a boundary, so if the value of the equation, if this is the equation, if we substitute the value of x0, x1 in this equation, x0 and x1 are the coordinate. If we substitute the value of x0 and x1 in this equation, knowing the value of w0, w1, w2, they are the coefficients of the straight line. Already we know the value. So substituting the value of x0 and x1, if the value is coming out to be 0, then simply we say that the point is located on this straight line. If the value is coming out to be greater than 0, we used to say that the point is located at above the line. And if the value is coming out to be less than 0, then we used to say that the point is located below the line. So same thing can be is used for a machine learning, for a neural network, to train the neural network. So the purpose of the neural network is just to get this straight line, equation of this straight line. And to get this equation of a straight line, the machine, the neural network, need to identify the value of this W0, W1 and W2. The identification of this W0, W1, W2 is what we call it as a machine training. During the training of a neural network, we are trying to get the value of this coefficients, W0, W1 and W2. And once we get this equation, thereafter we can predict whether the point belongs to this is located on this line or above the line or below the line. So suppose if we consider that x0 is the mean, x1 is the standard deviation, we have some data, we calculate the mean value and the standard deviation of that data, and we plot it on this graph. And coincidentally, like if we found that all these green dots, they are located on this area, and all the red, they are located in this area, and this green one, it belongs to same class, let it be class A, and all this red, it belongs to another class, let it be class B. So you can see that if this is the location of this class A and B, then if somehow we get this boundary, then with the help of this boundary, we can just do the prediction in the sense that simply thereafter, if once we get the boundary, this boundary means once we get the value of W0, W1, W2, means the equation of a straight line. Then thereafter, if I want to predict whether the point is located in class A or B, then what I have to do, I will just calculate the mean and standard deviation of a data. And after calculating the mean and standard deviation, I will substitute this value x0, x1 in this equation. And if the value is coming out to be greater than 0, I will say that it belongs to class A. Whereas if it is coming out to be less than 0, I will simply say that it belongs to class B. Right? So in this way, just the purpose of a neural network is just to get the coefficients. And once this coefficient is selected, thereafter I can use that particular equation for the classification purpose. Neural network can form only a single equation. Neural network means only one neuron of a neural network can form one single straight line. There may be a chance that I may have this type of a configuration that all my class A sample of class A lie only within this boundary, whereas the sample of class B, they are located outside this, means all over here. So if that is the case, so because my neural network, single neuron, can give only a single straight line. So to get this, to classify this, again we can use the concept of a straight line, equation of a straight line. Over here, if we get 3 neurons, one neuron will give the equation of this straight line, another second neuron will give equation of this straight line, and third will give equation of this straight line. And thereafter we can see that for if the value is located below it, on the left side of this line and at the top of this, then we can say that the sample belongs to this class, otherwise it is not. So over here you can look at this particular diagram, that these are the 3 neurons. These 3 neurons will just form the equation of this 3 straight line, and the output of these 3 neurons are then provided to another neuron, and this neuron will able to classify whether the sample is lie within this boundary or if it lie outside this boundary. So just if single straight line is not we are not able to classify the samples classes with the help of a single straight line, we can have more than one straight line. And in that case, we will have hidden layers. So in this way, we can do the classification using the neural network. We have other type of classifier also like SVM, decision tree, and other tree. The purpose is just whatever feature that we are extracting, somehow we need to make the make our system, we need to train our system for that particular features. This is about the classification. Clustering. Clustering simply means that suppose if in advance I do not know that to which class my sample belongs, like I do not know if it is class A, class B, or class C. So what I can do, I simply plot the data. I calculate it like, suppose this is mean, this is a standard deviation. I calculated mean and standard deviation of all the data that is available with me, and I plot it. And after plotting, if I try to make a cluster, like this can be one cluster because all these points are near to each other. It can be another because they are located near to each other, and this can be the third one. So if I am able to form the cluster, so there may be a chance that all this, they may belongs to one category, this belongs to another, this belongs to third. So in this way, I am just trying to analyze the patterns that are there in the sample, and according to the pattern, I can form the clustering, and I can then do the classification. So this is about the CAD system. Now coming to the CNN model. CNN model, like in the CAD system, we have extracted the features, means we have decided that which feature we should select, we should extract. Then we decided how to select the features. We do the normalization, also standardization of the data. So all that steps is done by us. In CNN, all the feature extraction technique is done on its own, means automatically it is done. We are not going to predict anything that which feature we should extract. It will be done automatically. How? In CNN model, we have this convolution layer, mainly the components that are there in the CNN model. It is convolutional layer. We have a ReLU and pooling, and the fully connected layer. So we can have different number of convolution layer, ReLU. We can have different number of pooling layer. So what is convolution? Just over here, if this is my image, and this is my filter, so to do the convolution of this and this, simply what I do, I just move this particular, like this is my filter, I put it over here, and then I will simply multiply and do the summation. So for this particular, I will get the value 1. Like for this, you can see 1 cross 1, 0 cross 0, 0 cross 1. So I just do the multiplication of this with this, and then I add all the value, I get 4. So convolution, with the help of the convolution, I am trying to get the weights. I am trying to get the features. Now in CNN, this values 10, 10, 10, this values is selected by the machine itself during the training. Means we are not giving the value to these features. In the starting, randomly we are going to give the values, but thereafter these values will be upgraded according as per the training. So in the CAD system, we are not changing this filter. If I am trying to calculate the frequency spectrum, so I am not modifying it, okay, during the training. If I calculated a frequency spectrum, I have calculated. Thereafter, I have not modified it. But over here in CNN, the features that I am extracting, the weights, this weights of the convolution layer, it is also like upgraded as during the training phase. So according to the output, according to the desired output, according to the different type of classes, the weights can be different. And So with the help of a convolution layer, we are extracting the features. After extracting the features, we pass all these features through the ReLU. ReLU simply, what ReLU is going to do, like over here we get all the positive value. But if we get some negative values, so that negative value will be converted into 0 by this ReLU, rectified linear unit. So it just make all the values, negative value as 0. And then we have the pooling, and it is a process of downsampling and reducing the size of the matrix. So suppose after the convolution and after applying the ReLU, if we get this particular image, so we simply downsample it. To do the downsampling, what we do, we just form a group of 4 pixels like this, 2, 2, 9 and 4. So in this, we are just selecting the maximum pixel value. So 9 is the maximum pixel value, so we take 9. It over here it is 7, so we take 7. Over here it is 8, so we take 8. Over here we have 6, so we take 6. So in this way, with the help of a pooling layer, we are able to do the downsampling and we are able to reduce the size of the matrix. So only the relevant and the most relevant feature, like over here 9 is the most relevant feature, 7 is the most relevant feature. So only the relevant feature we are taking to the next level. And this series of convolution layer, ReLU, pooling, we can have n number of convolution layer depending on the requirement. Okay, so in this way, we at the end we are at, like over here we have this convolution and ReLU, then pooling layer. After pooling layer we get this. After on this we again apply the series of convolution layer. Again we do the, after pooling we get this. Now once we get this, all the information, suppose if this is the type of the image that is present at this layer, so we just arrange this in a vector form. Vector form means that we just put it first column. After first column, we put the value of the second column. Means it will be 2, 9, 8, 3, and after 3 we will put the value 2, 4, 5, 1. So all the values are arranged in a single vertical matrix. Vector, we used to call it as vector. And that vector is then provided to the fully connected layer. This fully connected layer, it is our neural network. That all the features that we have extracted up to this layer, using that feature, now we are training the system. So if I compare this CNN with a CAD system, so in the CAD system, first we extract the feature and we do the feature selection. So that extraction of the feature and the selection of the feature is we are doing in CNN up to this level, right? And after feature selection in the CAD system, after feature selection we did machine learning. So that machine learning is same over here also. So the only difference is that while extracting the feature in CNN model, we are updating the weights of the filter, of this convolutional filter. And by updating the weights, machine is able to get the relevant feature on its own. If the features are not relevant, then machine update the value of the weights. And at the end, machine is able to predict the class more better in comparison to other machine learning techniques in most of the cases. So this is about CNN. Now coming to the application part. Now in application part, over here, the CAD system that I have used to classify the liver ultrasound images. So like whenever we want to apply the whenever we want to do a machine learning, and we want to predict the abnormality that is present in the image. So first of all, we should have a data set. So over here in the data set, I have considered this 5 classes. This is the image of a normal liver. This is cyst, like this is cyst abnormality present in the liver ultrasound image. This is the hemangioma, again different type of abnormality present in the liver. And this is HCC, hepatocellular carcinoma, again different type of abnormality that is present in liver. and this is metastasis. Again, the different abnormality. So different abnormalities I need to classify using the neural network. So first of all, I select the database, and like over here, this database I have collected from one of the medical institute, and that from that all the images that I have extracted from that images, I just consider I just take the ROI. ROI means that out of this abnormal area, I just select a small region, and out of that small region, after extracting that small region of interest, from that small region of interest, I calculated different features. So the different features that I calculated are this. Like I calculated these different features for all the ROIs that I have taken. And after extracting all these features, then I pass it through a neural network, and first I do the training using this data set, and then I do the testing. In the testing, the accuracy that I am getting to classify the cyst, it is 91.3, to classify SCC 97, 79, 87, 100, and the overall accuracy that I am getting is 92.1. So for the prediction of the biomedical images, we should, first of all, we need to prepare the data set. After preparing the data set, we need to divide the data into the training data set and the testing data set. And after that, we can extract the feature from both training and testing data set. From the training feature set, we are going to first train the neural network. And thereafter, we are going to use the trained neural network to predict, to test the, we are going to test the trained neural network using the testing data set. And the accuracy that we used to put in a research paper, that accuracy is just the accuracy that we obtain using the testing data set. In the training data set, even if we are getting the 100% accuracy for a training data set, that is not important. The important thing is that what accuracy we are getting during the testing phase. Because during training, we are providing both the input and the desired output to the machine. So there is high chance that the accuracy of the machine during the training, it will be quite high. But how the machine is working, how the machine is able, how accurately the machine is able to predict the class, that depends on the testing data set. Means testing data set will give us the idea about the efficiency of our machine. So we can develop the GUI for the doctors somewhat like this, more better than this. This is the GUI that I developed in MATLAB. So over here, different options are given. First, by pressing this button, load, image can be loaded, and thereafter we can do the segmentation or the ROI. So if for the segmentation, like segmentation algorithms are I have applied. So if I click over here, so it will just ask do the segmentation, and then if I want to select the ROI, means a small portion inside this, I can select the ROI like this, and then that ROI I can store into my system. Thereafter, I can extract the features and then do the classification. So feature extraction, and then if I click on this classification, it will simply tell me the class that it is a focal liver lesion that is present in the image. So in this way, we can just provide a software to the doctor. If our software, if our machine is working properly and with a high accuracy, we can provide this software to the doctor that may help the doctor in diagnosis. And remember that when we talk about the accuracy, like accuracy of 99% is also not good for the medical, because 99% accuracy means that there is a 1% chance is there that our machine is going to do misclassification, and 1% misclassification means that out of 100 cases, 1 case will be misclassified, means diagnosis to that particular patient, it will be wrong. And if because of this particular software, if we cannot afford the life of even one patient, So the accuracy of 99 or 99.99 also is not good. So presently, this type of systems can be used to assist the doctors and the radiologist. Final decision can be left for the doctors. But if suppose in case doctor have an opinion that the abnormality is of A category, but our software gives the result that the abnormality is B. So if there is a conflict between the opinion of the doctor and the software, then in that case, either the case can be put in front of the more experienced radiologist or doctor, or same doctor can re-examine the abnormality, the images again. So in that case, we can just, with the help of this type of a software, we are not making it for a final decision, to make final decision. We are just helping the doctor in making more accurate diagnosis, so that no patient means doctor, like as per the experience of a doctor, will not be a problem. Now apart from this, other machine learning, the application of machine learning in images are that with the help of the machine learning, we can use the machine learning to improve the images. Like you can use, like if I click on this images, you can see it is the input image and this is the output, and you can see how clear the information in this image is. Visually it is better in comparison to the input image. If you look at this image, this is the original one and this is the enhanced version of this, and this enhanced version, using the deep learning algorithm, we can train a neural network to zoom in the image at 2x or even 4x ratio. Means zoom, after zooming, usually image should get blurred. But if we are using a deep learning algorithm, we can increase the size and we can increase the quality of the image also. It means if the image is increased, we can increase, at the same time we can increase the visual quality of the image. So that we can do with the help of deep learning algorithm. For the medical images, like in this Zhu et al, they have published a paper to reconstruct the images, and they have used the machine learning techniques. For the segmentation also, we can use the deep learning technique. CNN models can be used to do the segmentation. CNN, it involves feeding segment of an image as input to CNN model, which label the pixel. The CNN cannot process the whole image at once. It scans the image, looking at the smaller filter of several pixels each time until it has met. So we see with CNN models, we can enhance the image, we can do the segmentation, we can do the image registration also. Now, what is image registration? Like suppose if I want to combine, if I have these two images, okay, and if I want to combine these two images, then if I do these two images without do the registration, then it produce this type of the output. But if I first do the registration means that I aligned this image A and image B. If I aligned both the images in the same direction, having the same geometry, and after align it with the image B, once I align image A with image B, after aligning means after registration, if I then try to fuse the image, I get a proper image fusion output. Like for example, in medical images, as I told you in the beginning, that this image and this image, they are the images of a brain of a same patient and same area. But the information that is present in this image, it is mainly the bone structure, and in this image, the information is mainly the soft tissue. If we combine these two information to get the final image, then we get this image. So the image fusion is one of the application of image processing tools. And to do the image fusion, both the images, they should be registered, means they should be aligned in the same angle, and the size of the image should also be the same. So this image registration can also be done with the help of machine learning techniques. Like you can see, the first way deep learning was used for image registration was the feature extraction. CNN successive layer managed to capture increasingly complex image characteristic and learn task-specific tasks. And this Yang et al. Has developed a non-rigid registration method based on the same idea, and using this VGG network, they are able to do the registration. VGG it is a type of a CNN network. So now coming to the application of machine learning in biomedical signals, like as I told you, different features can be used, can be extracted, and then it can be provided to the machine for training and then predicting. So like logistic regression. Logistic regression is a type of a machine learning technique. So it is used to determine, to classify the epilepsy using the EEG signal. Non-linear regression, it is used for the reconstruction of hand movement from EEG signal. Means with the help of EEG signal, we can determine what is the hand movement and how the hands are moving. Using the linear regression, researcher has published used this linear regression in this application to get the robust ECG artifacts removal. Means artifacts are removed using the linear regression model. LRGMM marker model. So this is used for epilepsy classification. Logistic regression for motion discrimination, logistic regression for ocular artifact correction. So there are different applications that we can have using the machine learning method. If we talk about the SVM type, again, different things can be SVM can be used for different things with respect to EEG. And ANN, again, it can be used for epilepsy seizure anticipation, for epilepsy classification. It can be ANN and SVM together can be used to analyze the EEG cross section and so on. So there is huge applications of machine learning in both biomedical signal and image processing. For ECG, like ECG using the deep learning algorithm like stacked denoising autoencoder with sparsity constraint, we can classify the heartbeats. We can do the classification of arrhythmia using this stacked sparse autoencoder. We can do the classification of arrhythmia classification using this UNet, LSTM, and so on. We can do this classification also using this DBN. So this is all about the application of the biomedical signal and image processing. So if anyone has any doubt, anything to ask, so you can ask me.
Anyone having a doubt? Participant? Any query related with feature extraction or one question? Shenge madam having a doubt?
Yes, sir. Actually, for the software and related with this, means it's really means first time I know all these things very deeply. I know little bit about this, but very nicely presented, sir. Things. Only thing I have regarding the hardware side, I have a question about the sensors. What is the means which level of sensors are required to get this data, and who is which agency is certifying this sensor that okay, these sensors are correctly working, or these are the sensors which need to be used in the medical applications?
Okay, like nowadays, like these electrodes, like even if you are, you must have heard that BTech students, they are trying to get the heart rates using these signals. So like the standardization of this signal, like electrodes, simple electrodes we can use to extract the signals from the body. And the only thing is that from the electrode, because the potential that is there in generated from the human body, it is in millivolts. So we need amplifier. So with the help of amplifier, we can make it like perceivable. Like we can then only get it up to the strength that we can measure. So any type of electrode, of course, biomedical electrodes that are available, like it is also available in like Amazon and different platforms. So we can get electrodes from there. And for EEG, like for EEG cap, again electrodes and other things, they are available through the through any Amazon platform. Also there are companies also, but the thing is that before practicing, we should know like the placement of the electrodes. It is the most important thing. And once we place the electrode, thereafter if we are getting a signal, then thereafter we can start analyzing it.
Actually, sir, in Corona, that SpO2 and temperature sensors, they both are using for the screening purposes. And based on that data, they are declaring the things in the beginning. So that's why that sensors and these parameters, which is defined by the WHO, that is the World Health Organization. So that parameters and these sensors, if we think that both are they are having a calibration with any particular agency, or it is just we can purchase and do that. It's needed a calibration.
Yeah, at the end we need a calibration. Like if I am just trying to design the ECG machine, so I can buy the electrodes that are available in Amazon also, Flipkart also, and I can purchase the electrode that will give me the raw data. But if I want to make it available for a doctor, then I need to do the processing, like noise reduction and different thing. It means I need to put it in a form that is that doctor can understand, and that is the standard pattern. Okay, so for that, calibration and other things is required. Like it is not like that only electrode, I just use the electrode and from there I just measure the voltage values and that's the end. So whenever I am using any sensor I am using, so even the temperature sensor or any sensor, so at the end I need to calibrate it, and
Sir,
then only I can make it available for the
which is the institute in India who calibrate the medical instruments, sir?
Because like my main research area, it is related to image processing.
Okay,
So
okay,
for that I am not.
Okay, sir. Thank you, but sir, it is nice, very nicely presented, sir. All the things. Thank you very much.
Thank you. Do such model need validation from medical professionals? Yes, if we are using, question is, do such model need validation from medical professionals? Yes, like even the CAT system that I have shown about the liver ultrasound images, if we want to make it available to the doctor, or even if I want to get it published, like paper, research paper publication, like it is always better to get it verified by the doctor, because the end user is the doctors or the radiologist. So if we want them to use the system, or the best validation can be done by the doctors itself. So we should validate it. And if like before publishing, if in the research paper, if we are mentioning that the method and the output of the method is validated by the doctor, and the doctor has graded, like if we are using 5 methods, and doctor, we just give the output of the 5 methods to the doctor, and doctor, they are grading the output out of 10. So accordingly, the validation should be done. And if we put that thing in a research paper, it improves the quality of the paper. And if we want to make our product commercialized, before making it commercialized, we need the validation from the medical professional. Without that, we cannot use it. How we reach to the conclusion with the hormone medical.
Dr. Baljit Kaur, sir.
Hello, sir. I'm actually very new into this area. I have applied machine learning on various text or structured or unstructured data. But recently, I have just got an interest in image processing. And I worked on 2 data sets. One was taken from the Kaggle, where, like you shared, that X-ray images were available, and those were compared using KNN and convolutional neural network to identify, to classify the X-rays to either they are infected or normal or pneumonia. But I actually wanted to work on the raw data, like these are all data where feature extraction is already done. So we recently got a raw data from one of the hospital. It was about prostate cancer, and some MRI images were shared with us. So it was really a challenge for us. Actually, it is a challenge for us to feature extraction and feature selection. So I just missed the last part where I think you have already explained all these things. Can you just advise some few? And one more before you answer my query, one more query is that what are there are many filters actually that you need to be used for pre-processing of the data. Can you just, because there could not be one definite answer, but can you suggest the approach I should take?
Like selecting a feature, like as I have discussed in the PPT, that selecting a feature, because we have large number of features that are available. So the first step should be that we should ask the doctor that what are how they are able to do the prediction. Okay, what are the features that they used to see? And after that, whatever features that we are studying means statistical feature. So whatever features that we are studying, we should know that what type of feature they simply quantify some characteristic. Like as I told you in the GLCM, that with the help of GLCM we can get the orientation of the line. So from different features that we are using, we should try to get the significance that what type of information it is going to provide, whether it is going to provide the information related to contrast, whether it is going to give me the information about like if it is the rough texture or the smooth texture and so on. And then doctor advice that how doctor used to predict, and then what are the different features that are available, their physical significance. Then I can try to compare and try to use that which may give me the best one. Secondly, most of the medical images, they are like noisy, right? Now, but when we try to remove the noise from the medical images, we also have a concern that we may remove some of the relevant information. But at the same time, because if we want to do the classification, so in the intermediate step, even if I remove some of the important feature that doctor may need to look, but at the end I get the correct classification. So that is okay. So means I may try with a different enhancement techniques, because using the different enhancement technique before going for a feature extraction, I may try to have different enhancement techniques that may help me to reduce the noise. Okay. So
yes, may I interrupt in between? Here, if we are applying different filters, we can verify that which filter is giving better performance? What could be the performance parameter?
Performance parameter, like for the, if we are performance parameter for the classification, it is simply like accuracy, sensitivity, and specificity. We should see all these three parameters, and if they are like, if I have 5 features, I can do the comparison of that 5 features. That which one is giving a better accuracy, sensitivity, and specificity, and accordingly I can select the best feature. I can, like, in some of the researchers, they also combine different features together, so I can try to do the
I'm saying if I am applying different filters for enhancement of my image, so which filter is giving me best result? How I can compare the performance given by the different filters which are applied during the pre-processing of the data?
like for that also, like suppose if I have 3 image enhancement techniques, so simply I will I will enhance all the images using enhancement technique 1, and then after enhancing the image, I will do the feature extraction, then I will do the classification and get this classification efficiency. So if I can have 3 classifiers. One classifier for enhancement 1, second for enhancement 2, third for enhancement 3, and another which I can have for the original image also. So out of these 4 classifier, the one which is giving me the best accuracy, sensitivity, and specificity, that I may select.
Okay, so at least I should proceed for the whole process for different filtering processes, and then I must. Yeah.
Right, because like when we are writing a course, so we need to like because in some cases we can try to go with the engineering scale, like we can try to identify which enhancement technique may work best for this particular images depending on the type of features that are there in the images. But in some cases, like because computational speed of our computer, it is too good, so we can experimentally we can try to predict that which method is giving better result. So in both ways we can go.
Thank you, sir.
Okay. Any other question from anyone?
Participant, any other question? I think question is over, sir. I would like to thanks for your an excellent presentation. Your presentation is very helpful and beneficial for all the participants, and all participants are motivated from your presentation, which include the acquisition of biomedical signal and their processing in healthcare application, and also helpful with the help of the machine learning tools for diagnosis the diseases. Thank you, sir. Thank you very much.
Thank you for inviting me. Thank you, everyone.
Thank you, sir.